You're right, Ralph? You ready to go? Okay. Makes a difference, doesn't it? Okay, thank you. Okay, everyone, I think we'll get back to another natural remedies talk. As I said yesterday, these are my most favourite meetings. I love these because so many people are so responsive and they give me lots of feedback. Okay, so we talked about the natural remedies yesterday, but today I'm going to start off with castor oil. Castor oil. What do we use castor oil for? Now, castor oil is a dispersing poultice. It's something when you put on, it will not draw any of the toxins into itself. So this is probably one of the only, maybe you could have got the Kaye poultice as well, but you could reuse this poultice over a few times. You do not have to throw it away each time and put new castor oil. You can actually reuse the same poultice for some time. How long do you use it for? Well, I guess that if I'm honest, you look at it for some time and you think, oh, I think that's had it now. I think I'll refresh it after a while. You know, maybe I'll use it a week or so if you're doing it every day. But there is a time limit to using castor oil. But you don't have to throw it away every single time. So, what do you use it for? Well, you use it to break up any bone spurs in your body. Okay, we'll just talk about external. Basically, I'm not going to recommend it internally, although, can I tell you, there are people who have used it internally and they've gained great results. But you've got to know what to do there. And often I'll have a class and they'll say, well, who took castor oil when they were a kid? And some of the older people say, oh, I took castor oil. And obviously they're not dead, so it's not like going to. But that being said, it is actually quite toxic. And you do not take much of it if you were taking it internally because it is quite toxic. So, but I am not talking about internally whatsoever. I'm talking about externally and using it as a poultice. So if we want to go to use, let's say you've got bone spurs on your heels or you've got a calcium deposit somewhere and you want to break it up. This is what you start massaging and rubbing into your wherever. Let's say you've got it on your feet or your heel or something like that. So you use castor oil. Now, what do I use? I would actually put it on and I'd rub it around first. Then after I'm finished, I possibly would just put it on a cloth and just then hold it in place with a bit of a... Sometimes I use Glad wrap, sometimes I don't. I just bandage it in place, whatever just takes my fancy at the time, whichever I'm using it. And especially would depend how big your injury. If it's only a little, you don't have to worry about putting plastic over it or anything. So I do use castor oil for lumps and bumps and cysts and all those types of things. Although when I say cyst, there is one thing that it doesn't seem to move, and that's fatty cysts have got encapsulated in fat. And you can have them, and I've had one of them, and I've tried to get rid of it with castor oil for so long, it just does not move it. It's like encapsulated in this fatty material, and it's probably one of the things I really couldn't tell you what to do for it, because if I knew, I would do it. So, but yet, castor oil, if you've got, especially good for breast lumps. If I had breast lumps, I would put it on a cloth, a piece of... I had some cloth here. What did I do with it? A bit of towel and cloth. I can't remember where I put it. It's just a little bit of just a bit of cloth, and then you just tuck it in your bra or something like that, or just tape it. Especially if you had some breast lumps or something like that. A lot of people who have fibrocystic breast lumps, you just massage it into your lump and then just put a little bit of poultice on there and just keep it in place maybe overnight. And generally they say as long as it's taken the lump to come up, let's say it takes your 3 months to come up, it will take you 3 weeks to get rid of it. If it's come up over 3 weeks, it will take you 3 days to get rid of it. You know, sort of you break it down a little bit like that. So it's not like, so if you've had a lump there for 20 years, it's going to take a long time to start getting rid of it. It's not like it's going to move overnight. But yet something like, it's really good for, as I said, for bone spurs, especially on your heels or anywhere that you're growing this lump or tumour that you don't know what to do with. Castor oil it all the time. That's what I would do anyhow. So you can use it. It's very good for sciatica relief. Now, what would I use for sciatica relief? Now, there's something which I've actually come across these. These are now castor oil packs. I don't know if anybody's seen these. And you can get castor oil packs. They're just like, they're flannel lined and they've just got this. And then you put, this is actually excellent for your liver. And they've got elastic to go around. And you just connect it up and then you just put it in place over your liver. And just put it on. It's got Velcro and you just put it through the buckle and just go back on yourself. And excellent for your liver. So you can put this on your liver, I would say, and you could put it anywhere. It doesn't matter, doesn't have to go on your liver. If you've got a shoulder problem, you could put it on your shoulder. You could put it on in. I've got smaller ones like this, which I forgot to put in, but I've got it for my knees. So I bought them online. I went online and I found these, and generally they would be probably around about the $20 in that price range. With or with, depending where you find it, with or without, you might have to pay a little bit for postage. But when I bought mine, I actually bought the ones for the knees, and I think I bought one for the elbow. I just buy things just in case I need them. Okay, I don't need it for my knee or my elbow or anything like that, but I have it ready for them. So what do I use this for other than that? Look, anywhere. You could put it on. I know I used it a lot because Peter had this tumour here and I used it often around here. This is where we put it constantly, on that part there.
Where do you put the castor oil?
The castor oil goes on that cloth there.
It doesn't go through?
No. Obviously, you're not going to use heaps and heaps of it. First of all, I would massage the castor oil into your skin. And then on there, I would probably put about maybe 3 tablespoons, 2 or 3 tablespoons over there. So I would just drizzle my castor oil. And then what I normally used to do is I get the blade of a knife and I just spread it out evenly. And then I would put it over wherever I would want to go. And so obviously that we got to the stage we had it down pat because I even put the plastic. I sewed some plastic on here because I didn't want it coming through on his clothes, which he often would wear it underneath his clothes. And he found, can I tell you something? He found that the moment he put it on, it actually took quite a bit of the pain away. So it is a pain relief. So if you've got, let's say you've got sciatica and you've got it there, you'd put it along wherever your sciatica is. Castor oil is excellent. Now, if you don't have one of these, that's fine. Just use a hand towel. That's ideal as well. And just use a hand towel. What I do is, if I've got a hand towel, I'll just grab an old, like a plastic bag. These are carry bags. I've just got them and I've just cut them because they're stronger plastic. You know, Glad wrap plastic is just goes, you can't control it. It's just everywhere. So I just use something like that. Then I'd put that over it. And then I'd just use a tighter pair of pants or something like that, or a briefs or whatever, to keep it in place. That's what you need to do to keep it in place. So it works well. So that's if you had sciatica. And if you or something in your hip, you'd do there. I actually remember, oh no, I'll talk about that one. That was with charcoal. Okay. But you can use it for your pack over your liver. You can do that. That is an excellent pack for liver. So many people have got liver problems. This is one thing we need to do. And so I figured, well, if I'm going to do it often, I'll get a proper pack. because the first way I learned was I used blueies, and I would just get the bluey. Now, a bluey is just a plastic-lined padded fabric. Now, it doesn't have much padding in, but you didn't need much. So what I would just do is I'm not going to do it because it'll just get everywhere, drizzle everywhere, but I would just drizzle some more castor oil over that, and I would put it over my liver, and I would just put some plastic over the top. Oh, it's got plastic on it, but if it just was like a cloth, a face cloth, I can't remember what I did with them. I just moved them all. I must have put them in my other box. Okay, and or an old face washer, that's ideal too. Face washers are a great size for putting over your liver area. Then I would put a bit of plastic over the top of it, and then I just tuck that in my briefs or something like that and just keep it there. Another way where you can do it, for a lot of women, especially young women, have cysts. Maybe they can have ovarian cysts or even fibroids or something like that. What you can do there is you can actually, what they said, Barbara told me about that. She said you just use a panty liner. So put the castor oil, soak that into the panty liner, tuck it in under your briefs, and there's a stick-on section on it that sticks onto your briefs, and you can just pop it in place and it'll hold in place, and you can wear it around for hours. So you'll be able to, you don't have to put it on any special time, and it's there for hours, but just stick it in place. You could use it on anything, really. It doesn't matter what it is. So that's a good idea, because sometimes what I've told people too, especially for men, or when you want to put it in that, often they want to do it for prostate. You can just cut a menstrual pad in half, soak it up, because it's got a lot of padding in there, and usually it's plastic lined, which is ideal, and you can just tuck that in behind the men's scrotum, and you can use that soak it up with castor oil, and just get them to wear firm jocks that hold it in place, and it's fine. So as I said yesterday, sometimes it's very hard to get certain spots on your body. How do you get poultices to stay in place? It's not easy. I can remember a man he had stomach cancer. He was late stages stomach cancer, and you girls over there would know who this man is. Your dad, wasn't it? Late stages stomach cancer, and he said to me that how he had a lot of pain at night, and the one thing that reduced his pain were the castor oil poultices over the whole abdomen. And I can remember, and I said to your mum, I said to his wife, I said, keep it in place. How are you going to keep it in place? And she couldn't work out how she'd keep it in place. I said, get a pair of your old pantyhose, cut off the legs, and use that. And she kept it in place, the stomach compress in place, using her old. And she said they had a good laugh every night as he put it on. Yeah. Yeah. But he did say one night they were out, and he said to her, look, it's just, don't worry about it tonight. But he got to bed and he said, I think, can you please make it? So she got up and put that on. She said, it just takes the pain away. Castor oil is a beautiful way for pain relief. Now, I used it with Peter when he was having this problem with his pain. I tell you what, there is pain and there is pain. Okay, if it's just a normal pain, it will reduce it. But if it's severe, absolutely critical pain, it just doesn't touch it, okay? So, there are some levels of pain that you've got to realise it's not going to touch. So you can relieve it, but you can put it over. And if you had constipation, you could even put it over this area as a poultice over that area, whichever way you're going to do it. If you get one of these are ideal. And after a while, you can even launder them and you can wash them and you can start out again. That's what I've done with a couple of them, because after a while, you sort of think, oh, I think it needs to be washed, Then you pop it in place and you can just put it over this area. As I said with Peter, we put it over that area lots. And what I did, I'll talk about that with the charcoal poultice. But you could use it for irritable bowel, anything like that, any problem with your abdomen in there. You could use it for anywhere. You could put it over, you have a shoulder problem, you could fasten it in place over there like this. Somehow, I don't know, you could sort of get it in place. Where there's a will, there's a way, they say. And this particular one has a zipper, which you can open up the zipper and you can put in there a hot water bottle. So you've got room, doesn't quite fit, but you can put in a hot water bottle there, or a hot pack. Hot water bottles don't fit too well, but a hot pack you can pop in there. Ideal if you're going to have it over your liver area, because it's good to have a hot pack over it. I agree. Castor oil is extremely sticky and it's messy. I can remember one woman, she told me she had extreme vertigo. She said that she was stooped over like this all the time. If she straightened up her head, she went dizzy. She just went whoa all the time. So she had to walk around constantly like this. And she said after massaging her neck with castor oil, she was able to straighten up quite a bit. And she was so thankful. She said, thankful, at least I've got my life back a little bit, that I can actually straighten up and I'm not quite so dizzy all the time. So remember, it will break this up. So use castor oil. Now, what sort of castor oil do I use? There's normal castor oil, which you can buy from you can get from some health food shops sometimes. This is just this is a proper jar which contained castor oil. Because it's plastic, but it's special plastic that will be able to handle castor oil. But I've also bought a black Jamaican castor oil. Now that's another castor oil which I've come across and I love it. It's got this beautiful smell to it. I don't know what this one is. No, this is normal castor oil. It hasn't got that beautiful, and it's got this black tinge, this dark tinge to it. And it's really excellent too. Because I did one class in America, and one lady, she said she had all this build up, this tightness all in her abdomen after she had a cesarean. It was over 20 years she had the cesarean, and she started to break all this scar tissue up with castor oil. And she said, she came in and she said, guess what, it's working. But she says, I'm using Jamaican castor oil, because she was from Jamaica. She says, I'm using Jamaican castor oil, and I know there's a difference. It's a lot more expensive. Now, you might go online. I know I went online. I bought a litre of castor oil, or 5 litres of castor oil, 5 litres of castor oil. And the name of the place was nakedpress.com.au. nakedpress.com.au. I've got a price here written on my page. It was 5 litres for $85.
I put it on my hands and it's very sticky.
Yeah.
So I rub my hands together, then I put them on my face.
Yes.
And because it's still sticky, I put the excess I put on my legs.
That's right. You know something I do. Okay, now I'm glad you reminded me that, Judy, because there's another way you can do. This is a super way for facials, ladies. Go get in your bathroom and put a face washer on your face. Get it nice and hot. Immediately up, while the pores in your face are still open, just put about a tablespoon of castor oil in your hand and just rub it all over your face and just massage it in. And keep massaging it in. You can massage it in for 1 minute, 5 minutes. You can massage it in for 10 minutes. Then after you're finished, just get in there and splash it off. Now, it sort of doesn't come off really well, but I use the same face washer to bring it off, and then it's finished. And it seems to, I don't know, it just doesn't stay sticky. It really works well. This is a super way for a good facial. They say that it's a better facial than if you paid hundreds of dollars for a facial. Can we have a microphone, please? Yes?
Okay, I have two questions or two points. With castor oil, it's an excellent pedicure. Rub
Yes.
it on your feet and they come out so supple and takes away any dryness or anything around your toes. It's
Okay, so how are you
really
putting
very
it
good.
on?
Just with your hands like you do your face and hands. Yeah.
Yes?
Yeah. And also, my query with the castor oil around the belly, would that be good for like teenagers with cramps, with period pains? And things like that
Absolutely, absolutely. But can I tell you, with period pains for girls, I find a better one is the hydrotherapy. It's the hot foot bath. That is even better. And I'm going to talk about that tomorrow. But so remind me about the period pain for girls, because I've worked with teenagers on that one now and I understand. So I know it does work much better. Okay, he's got his back to you. He can't see you. Okay, so castor oil. So back, go on. Hold on, another, Jessie.
In your book, you've got that for eye irritations, you can use a drop in each eye at night.
I know.
You mentioned to me that it can help with cataracts. So would putting a drop in my eye each night be okay?
Yes, it will. Absolutely. It doesn't harm you. I've been doing it for years. Okay? Okay, just hold on. Jimena, do you want to tell them your story about castor oil in the eyes?
The way how I did to start, I went to optometrist, and the optometrist said to me, "You got cataracts." So I was doing my research about natural things, castor oil, and then I was using castor oil, one drop in each eye every night. And
Inside the eye or on the eyelid?
Inside the eye. I open my eye, I put inside one drop in each eye.
Making sure it gets on the
Yeah,
eyeball.
on the eyeball, yeah. And then I massage a little bit, very softly, and then I switch the lights off, and I sleep. In the morning, wash, total normal. So I was doing for about a bit more than 3 months, maybe a bit more. And then I went to my optometrist. I checked up to check up, and he looked, and properly he said to me, "Let's check and have a look properly," and gone. No more cataracts. So I always advise people to do that, and I got friends already who end up doing, and no cataracts.
Now, can I actually tell you that, and I agree with you, but if you've had your cataracts for quite a while, they're very stubborn. They don't just quickly go away, right? You can, if you've just got them, you'll get rid of them quicker, but if you've had them, were just not long developed. Okay, they are easy to be, so the longer you let it, the harder they're going to get to reverse. Yes, you have to do it much longer. Now, I've done it because I've had cataracts now that they told me that I need to be operated on, and I've never got operated on, because every time I go back they say, no, they're fine, but they're still there, but I'm still working on them. But with this castor oil in my eye, what I do is I put 3 pillowcases on my pillow, because I tell you what, it does get over your pillowcase. Okay, and I don't want to spoil my good pillow with castor oil, because it does get everywhere. Okay, so you've got to be careful. And even if you do it over your liver, some people don't like doing it over their liver at night time. They like to wear this pack during the day, which is better in its winter time, because if you want to put that on the summertime, it's pretty sticky and hot. But in the winter time, you can handle it better. So that's the same way. Now, getting back to that face thing, you can also, it's really good for, I do it for face, I make it as a base for my face cream, and the recipe is in my book for making face cream, which will actually dissolve into your face. It doesn't stick on the outside. There's one with a face ointment, which is very sticky, it leaves a residue, but the face cream just melts right into your face, because you've got to use it with wax. So You also can do, what you can do, another thing, if you've got hemorrhoids. Now, this is something, and if you've ever had hemorrhoids, you know how painful they can be. And a lot of women get hemorrhoids after they have their babies. And what you do is you soak a cotton ball in castor oil and you put it in the deep freeze. And you freeze it, and then you put that on the hemorrhoid and you get your buttocks to hold it sort of in place like that, squeeze it in place, and immediately it takes that pain out of the hemorrhoids. It becomes much, much bearable. Although you can do, there's another, you could even use that, you could even soak it in. Another treatment for hemorrhoids, while I think of it, is aloe vera. And you freeze aloe vera leaves and you skin the outside, but you've got the gel, and you freeze it into the shape of a suppository, and you can insert it in the rectum, and it will go in because it's like frozen. And then what happens, it'll melt inside you, but that's fine. And when you go to the toilet, it'll just come out. But that really will help. So to get it inside, use frozen things. And if you wanted to get castor oil inside, you can put castor oil, and you can use anything really else to bind it. But you can use, if you want to make a suppository of castor oil, and let's say you could put something like a charcoal or something like that, or borax or clay, and you can put a rubber glove, and you can fill up the fingers of a rubber glove with this, and you freeze them, and then you take that plastic, the rubber off, and you can insert that, and that's a suppository. So that's a great idea for hemorrhoids, which I know because years ago I can remember having hemorrhoids, and I tell you what, it was the worst thing that ever out, because as I said, a lot of women get them when they have babies. Okay, now what we've done, actually I should have put a little bit on this bluey, and I'll just drizzle a little bit over there, because what I'm going to do is I'm going to turn this into a cayenne poultice. So you don't need much. Now you can to make a cayenne poultice, I'm going to do cayenne on the outside. I'll talk about inside first. You just make a little bit of oil on the outside. So what I've done here, you can see that, can't you? I've just drizzled that on the outside there. So what I'm going to do over that, I'm just going to get some cayenne pepper and sprinkle that over there, because if you didn't have the oil on there, the cayenne pepper wouldn't stay in place. Now, if you put water on there, it will dry up and it still won't stay in place. So you really need the oil. Now, how much cayenne is really up to you. How much can you heat? How much can you handle? So have you got an injury? We really need to get it. Who wants to volunteer for this? Okay, Jessie. We're going to get Jessie here. Where have you got your injury, Jessie?
On my knee.
Okay, on your knee. Okay, so how much have we got on there? Okay, so what we'll do is we'll come around this side so everybody can see you doing it. Okay, whereabouts? Maybe if we just get you to grab a chair and bring it over here and you can sit down on it. And we need to know the progression of this, how it feels as you go through.
Okay.
So we're just going to put it on like this. Just straighten your leg up a little bit more, thanks. And I'm just going to keep it in place with Glad wrap. Or this is packing tape wrap.
There we go.
And generally I find it's the little old women can handle more heat. There you are. That's as simple as that. Now, how long do you leave it on for? How long can he handle it? Now, you can leave it on overnight. I don't know how much he can handle. He may be able to handle a heap of cayenne pepper. He may not be able to handle much at all. Generally, it depends on how much uric acid they've got in their system. Because if they've got a lot of uric acid in their system, they react pretty strongly and it gets very hot. So we just got to work at it. And if it doesn't heat up after maybe 2 hours, you can actually put a hot water bottle on it to get it activated. That really sends it along. So you can do it that way. Okay, so see how it goes? So that wasn't long. We'll leave it there. Now I also did another poultice, a cayenne poultice. I had a young man and I did one like that on one leg. On the other leg I mixed flour and cayenne pepper and water and I made a paste. I made it pretty hot and I put it on like a poultice, like I spread it over a cloth, straight on the skin, glad wrapped it in place. And I said, okay, now as he was sitting there, I said, now which one is hotter? And he said the one with the flour was much hotter. So you can try them. You can try which one you want to do. I've just chosen that one because it was just as easy to do with the cayenne. Okay, so you can use it on any injury where you want blood to the area because the blood is what's going to bring the healing. You would use that on a frozen shoulder. You would use that on a seized up joint. You've got arthritis. You put it on your knees, your elbows, your shoulders. You use it on your lower back. An awful lot of people I know have got lower back problems. I can remember one woman, she said that she used to put a poultice, and it may be about that size, and she'd put it on there. And she was an ex-nurse and she had such a bad problem. And she said she used to put it there and she said she kept it in place. And she said that was the way she existed for days. She loved it because it brings blood to the area and it's a warming poultice. It's supposed to make you feel warmer as you go through. Now, if it doesn't get warmer, what's happened is you need more cayenne on it. So, it's already starting to get warm. Now, can I also just say to you, if it gets too hot, that's all right. Take it off. What I just do normally, if it gets too hot, I would just get the pair of scissors up the side and just cut it off and take it off. But it's good. That's a good reaction. We've already got one. There's nothing worse than having sitting there for 3 hours and saying it's not doing anything for me. That it's doing something in a couple of minutes is a good sign. So it's starting to warm up. But don't let your people think, Jessie.
Now, would you leave it on, put it on again?
Yes, you could.
Yeah.
Okay, it wasn't you. Was it you, Stephen?
I was just going to ask, you could just use that with castor oil or olive oil?
Absolutely. It doesn't matter. You can use coconut oil, any oil. What the oil does is it actually just acts as it sort of holds the castor oil in place. So you could use it on the soles of your feet. You can use that anywhere at all. So soles of your feet, because it's bringing blood to the area. The blood is what heals you. That's what brings the healing to you.
I can tell you something also about cayenne.
Okay, just hold on.
I went to the doctors, and the doctors, because I got pain in my calf, and they say we have to do an ultrasound straight away. So I had an ultrasound, and the ultrasound was showing 3 clots, 3 huge clots. One was 3 to 1 centimeter, so big ones. And he was panicking more than me. He said to me, "Oh, you have to start straight away on blood thinners." My son was with me, and he was really worried as well. So straight away, you have to take blood thinners, otherwise you will have a heart attack or you will have a stroke. Okay, so we come out of the doctor. My son, he says to me, "Oh, we have to go to the pharmacy. We have to buy straight away." No, I said, "I'm not going to take anything. No blood thinners for me." And he said to me, "Oh, no, this time you will take it. Even if you don't want it, you have to take it." He was getting angry and red in his face. And I said, "You have to respect me. I don't want it." Anyway, we went to pharmacy. At the pharmacist said, "Do you have? This is the first time you're going to take your blood thinners?" "Yes," I said. And then she said to me, "We need your blood results. Do you know if your kidneys are okay?" "I think I got creatinine problems." I said, "Oh, so better don't start. Come back tomorrow." "Okay, wonderful," I say. And then my son couldn't say anything. So following day, I say I need a second opinion myself. I want to do a second opinion. I want to go. So I went to another doctor, which was to another hospital, not the hospital where I used to work. And then they done another ultrasound, exactly the same thing, 3 clots. So the nurse came with 2 tablets in her little cup and said, we have to take now because the doctor wants you to take right now. I look at her, she was looking at me, she didn't have water in her hand, so she went to get water, so I put the little tablets straight away in my bag. And then when she came back, she said to me, did you take the tablets? Yes, I said. My friend was sitting next to me, and she was just looking at me. I said, I don't want to take it. And then I didn't take the tablets at all, and then they give me a prescription to continue to take it at home, my blood thinners. And then I doing my research as well. So I use cayenne. In a little bowl, I mix a lot of cayenne pepper with castor oil. I was putting in my food every night. As I went to sleep. In the morning, it was a little bit red, a bit pine. Still
It was
burning.
cayenne poultices you were using?
Yeah. So I was using that for probably 1 month, 2 months, something like that. But then my leg got better. So I never used blood thinners, and thanks God for that. So I feel okay.
There you go. You used cayenne poultices for it. Yeah.
Because I was thinking if I take the blood thinners, I will stop eating all my greens. And I love my greens. And I said, how can I do that? No, I'm not taking blood thinners. So
Yeah.
it was good. Thanks God for that.
So you can put, now the other way, if you want to heat up your shoes, if you got cold feet, you can actually sprinkle them in your shoes too, in your socks. Yes?
Okay, would that also help varicose veins too?
I don't think so. I don't know, depending how bad your varicose veins were, because if they were, if you've swollen, if your vein is actually coming through the skin, I can't see it, but it may help somewhat because it's going to bring circulation to the area. And circulation is going to heal lots of stuff. Yeah. Okay, so the other thing is, I just said feet to keep your warm your socks up. That's an ideal way. I can remember my son, he had a hamstring injury and he was living alone at the time, and he wanted to be ready. He had a cricket match on or something like that, and he wanted to get his hamstring right, and they were told it was a month or so, and he halved his recovery time. But what he did, he got it. You're living alone, you think of all sorts of things. So he lay the poultice out on the bed and he sort of sat down on it and brought it up around him, because it was very difficult, because sometimes it's hard to put things on yourself when you're living alone. So he did that, and he said in the middle of the night he woke up, it got that hot, he just had to take it off. And look, if you have to take it off, that's all right. There's no shame to take it off. Your body is just heated up. There's no rule that says you've got to leave it on and you've got to bear it until you're like it, because it does get extremely hot and it feels like it's burning. But so what? Take it off. It's all right. But I can remember one man came around to visit me and he was walking around like this. He said, don't mind me. He says, I've got cayenne in my shoes. He said, my feet are just burning. They are so hot. So, and you can sprinkle it on the outside. Another thing, it will stop bleeding. And you've got to cut. I can remember I cut myself with a knife in my hand, and I just quickly sprinkle it on. Then I get a cloth. What do I do with my cloth? I just get a cloth, and I put it over the top. And I lift it off and I put a little bit more on. Hold it on there. And then I don't disturb it. I'd put a Band-Aid on, I'd let it sort of sit there for a while. Then after a while you can sort of brush it off and clean it up a little bit, trying not to disturb it. Though you don't have to take all the old cayenne off, just allow it to build up. Then put another cloth on it. And you know what? Then all of a sudden it'll just be right and you'll be able to put it under the water and wash it off. And it brings blood to the area. Remember, blood is what's your friend. It's going to bring the healing. So it cuts the healing time right down. I can remember Peter was saying that he went to, he was taking a wheelchair to visit a lady, and she'd cut her heel on the plate of the wheelchair. And she said she was just bleeding profusely, and he just got cayenne over it. He sprinkled it around and he just bound it up. And she said, she was a handicapped girl, and she says, "Thank you, doctor." Yeah. Yes?
Would that help for Achilles pain?
Yes, I think so. All of those sort of things. Because it's the heat to the area that you've got to use. And so you can take, as that's on the outside. Can't think of anything else on the outside, can you?
Crush fractures.
Crushed?
Crush fractures.
Yes?
Russ had it on his when he went to Highwood Hill.
Okay, just hold on here, Jess.
Russell had a crush fracture from a hard landing when he was paragliding, and went to Highwood Health. I couldn't manage him, and they put a cayenne pepper poultice on, and it burnt like crazy. But then they did it during the day and put a different poultice on at night, and it really made a difference.
Oh yeah, it does. Yep. Okay, so the other thing is you can take cayenne internally. How do you take cayenne internally? Well, normally with great difficulty if you can't take it very easy because it's pretty hot. Although they believe it works better if you take it in soy milk. It will just calm a little bit of that heat down and you can take more of it. So, cayenne internally, what do we use it for? Okay, what do we use it for? Sore throat, yes. Go.
With the cayenne pepper, I can't stand cayenne pepper, so I make my own capsules.
Yes.
And I just swallow them so I don't have to put up with all that pain. So I was just wondering, do you have to have that experience of the shock in your mouth for it to work properly, or can it just go straight down to your stomach?
Okay, I know that it does work better if you have the shock in the mouth because it tells your brain there's something coming. But can I tell you, it's better off than none if you take the capsules. I've taken the capsules too. They're great because they slip down nice and easily.
Yeah.
But the reality of it, you need to take them with food because if you take them on an empty stomach, that can make you feel nauseous.
Yes, I've discovered
Very nauseous.
Yes,
And you can think, oh, my stomach.
Cayenne pepper orally for my blood clots as well because that was not enough for me to put the poultice. So I put in a cup of water, like half a spoon or sometimes a bit more of cayenne pepper, and then olive oil, and a little bit of garlic as well, and a little bit of salt.
Just hold on. Just bring it round here.
Together, and I drink.
We'll just get that on the tape.
Yeah, I didn't put much water.
Just repeat what you put in your water.
Okay, so that was a glass of water every morning I was taking to help myself with my blood clots. So I put in a cup of water, half a spoon of cayenne pepper. Sometimes I was putting a bit more. Then I put lemon juice, olive oil, garlic, and a bit of salt mixed together and drink every morning. Actually, it doesn't really burn, but it is the taste with the lemon juice, everything. It is nice. That's nice.
There you go. It is debatable whether it is nice. I had one lady, I met her. This lady came to me and she wrote a story up. Some years ago in one of my earlier newsletters, I wrote her story up. This lady was having very, very severe bleeding, menstrual bleeding. She was going through a change of life. She was well in her 50s. And she was bleeding and she'd bled something like for 18 months, pretty much continually. And so she was desperate. She wanted to stop them. And she went to a naturopath and said, this naturopath told her she had to do two things. She had to clean up her mind, like she had resentment for her mother-in-law. That was part of it. But the second part of it is in her diet, she had to change her diet. But the other part of it is she had to take 3 teaspoons of cayenne pepper every hour, on the hour, for 3 days. Now, she didn't take it overnight. She gave herself the night off. And would you believe, she said, and that's where she learned to take it in soy milk. She said you could get it down better in soy milk. But she said after that 3 days, the bleeding just stopped like that. So you can do it, it will stop. Another lady, she came to me and she had her elderly mother had a bowel bleed and she was going to hospital because every 9 months or so she would take her elderly mother to hospital for a bowel bleed. They doctors didn't know what was caused it, but it would meant 10 days in hospital and it just recurred every once in a while. It just came back. And she rang me one night and she said to me, what do I do for a bowel bleed? And I said cayenne pepper, give it to her orally. So she gave her only 2 doses. It was late at night. And then in the morning, she let her mother go to sleep. And in the morning, the mother says, I think I'll go to the hospital. And so she took her to the hospital. She was put in. But the next day the bleed stopped. She says this wasn't normal. It never had happened before. And she knew that it was the cayenne pepper had stopped it. Even though she knew that she had to go with the mother's desire because she wanted to go in. Sorry, Wendy.
If someone's about to have a heart attack or in a heart attack, can they take the cayenne pepper capsules or do they have to have that mouth shock?
Mouth shock.
Oh dear.
They need that mouth shock. Can I tell you something though? I think I told you this, didn't I? I told somebody. I can't remember whether I told you. There was a lady. She was in my class. She had the cayenne pepper, and she had. I think it was yesterday. I told you that she was, but she was in a class down at Highwood with Barbara, and they said that she just keeled over, and they put cayenne in her mouth. And when she was saying it afterwards, when she was talking about it, she says, I was in that class, and she was in my class in Albury. And she said to me, she said to the whole class, she says, I didn't taste it. You must understand, you're really in a situation where you're not worrying about what you're tasting like. Oh, I don't like that taste. You don't think like that. Your body is like reacting, Look, how much would you have? I would get in as much as I could, whether I put in a half a teaspoon or a teaspoon. You just get it into the mouth. And Peter said that he was in New Zealand and there was a man having a heart attack and they put it in his mouth. Peter said, we put it in his mouth and they just get him to sort of try to drink a little bit of water. It doesn't matter if you don't get water down. Okay, just get it in the mouth. Just do the best you can because that actually brings somebody out of that heart attack or stroke. It doesn't really matter. So you can do either of those things. Any other things we're talking about on... you can actually mix it with honey and it become a cough medicine. I can remember one woman, she came to one of my classes and she just had this coughing fit. And so it was Bernice. She went out into the kitchen. She's got some cayenne pepper and Gabe brought it back into her and she had half a cup of water with some cayenne pepper and she just put it in front of her and said, drink. And so she drank it and she went, oh, but it stopped the coughing. Tooth extraction. So if you've got a tooth out, what it does, it actually clots your blood very nicely. Your blood flows thinly, but yet it does actually have a good clotting factor in there. So it's really good for having cayenne. Now, helps lower blood pressure. Did you find that out? Okay, there you are. Helps lower blood pressure. So we've got to think of all the things we can do to help ourselves. Okay, next I'm going to deal with is charcoal. Now, what is charcoal? Can someone tell me what charcoal is? Where do you get charcoal from? You get it from the wood. Wood fires. It has to be clean wood. You do not use any treated wood, but just normal wood out of the paddock. And I can remember going over to my son. One of my sons lived in Adelaide at the time, and Simon went over there and on the way over, he ate something and he got food poisoning, So we got up there about a day or so later than he had food poisoning and diarrhea and vomiting. And so I said to him, charcoal, and I didn't have any. But there was a wood fire there. So I went to the wood fire and I got out some coals out of the wood fire and I banged them with a hammer and a rolling pin and I got them down as fine as I could. I put the powder into a blender to try to get it into as much powder as I could. And then I got this little bit of powder there and I gave it to him to drink. And probably half an hour later he says, you know what, I'm feeling a lot better. He says, I'd like some more. Can I have another dose? Now that was out of the fire. Believe me, that works. Now what is the difference between that wood out of the fire and what we call activated charcoal? What is the difference? Well, wood out of the fire works, but activated charcoal is wood that has been treated, and it's burned inside a huge vat, actually it looks like a bit of a milk truck tanker. You know, it's like they put all this charcoal, and what they do is they burn it in there and they infuse it with steam as it's burning. And what it does, it makes the charcoal molecule or the charcoal burn deeper. Now, if I showed you a picture of a charcoal molecule under a microscope, this is a charcoal molecule under a microscope. Where is the camera? Can you see that? Which one do I do? This is a picture of a charcoal molecule under a microscope. And what it is, it's not like a molecule you think of. It's not like a round sphere, like with smooth, cylindrical surface area. The surface area has crevices and that goes in and out and around and down and in and out and around. So it increases the surface area of this charcoal molecule incredibly. That actually has a magnetizing pull, you know, like Velcro does. It actually attracts things to it. It's called an adsorption property. So it pulls toxins into it and binds it to it. And what it does, it holds any toxin. So that's what it looks like. So that's what an activated charcoal molecule is. Activated charcoal is probably about 2.5 times stronger, has a stronger pulling power than normal charcoal. So activated charcoal, you need to have it in your house. What do they make it from? A lot of time they make it from coconuts. That's ideal. So this is activated charcoal. It's very fine. It's fine powder. And what do we do? You can take it internally and externally. So let's just do on the externally first. You make it into a poultice. How do we make it into a poultice? If you mixed charcoal with water, you can just mix it with water. If I was drinking it, if I had diarrhea, I would mix it, or an upset stomach, I would just put a teaspoon in a glass jar. I just get an empty glass jar, like wherever just an empty jar, put a bit of charcoal in the bottom, put a bit of water in there, shut the lid tight, and then shake it up and just drink it. Well, and you have to be careful because it's the messiest substance there is, okay? It gets everywhere, believe me. You can have it here and, oh, look, there's a bit over there. How did it get over there? I don't know. It just jumps around, I'm sure. So charcoal is very, very messy. So you can do it that way, or if you want to make it into a poultice, you can put it in, and you can mix it up in a bowl. You can mix it up. Sometimes I would mix it up with, flaxseed, ground flaxseed. That's the way we used to do it years ago. You just get, I just have flax seeds. I can't remember. Here's my flax, no, that's not it. Flaxseed. Here are my flax seeds, just little seeds. And I would, or linseeds, whatever you want to call them, they're the same thing. Just little brown seeds. And if you if they probably works a little bit better if it's ground, but if you don't have ground ones, just use the whole ones, and it binds it together better, so it holds it in place. So you mix a little bit of flaxseed in in your charcoal, and you stir it to a paste. Or you could mix some psyllium. So I've got psyllium here, which I put psyllium, psyllium husks in it. That works wonders too. So you can mix it, and sometimes some of the people I've seen people who actually mix it up like a dough and roll it out between 2 sheets of plastic and becomes like a thin piece of pastry, and you can cut it up into sections and you can freeze it. Because there's one thing about doing a charcoal poultice, it has such magnetic, powerful pull that you don't want to make it up ahead of time. I remember we were doing a breast cancer patient once, and we were doing these charcoal poultices, and we had people rostered in every day. Somebody else was going in and doing it. And one woman got a bit excited, and she made a whole lot of charcoal poultices up for about 7 charcoal poultices. And I went in there and I said, oh no. She put them in the fridge, and they had absorbed every odour from the fridge into the charcoal poultice, and they were really virtually, I just threw the lot out. But if you make them up, you need to deep freeze them, put them in the freezer. But generally, and sometimes you need to have 1 or 2 in the freezer, because if it has to be thin, and then you can put it over wherever. If you don't say you've got a bite and a bee sting or something, so you've got one ready there for it. But better still, what I've done, and I use this a lot of times, I have done so many of these with Peter, I just knew how to do them with my eyes shut. So what I did is I use a Glad bag. Now I've only got a little bit in this because I've got a small one that I made up here. I've got a 1/4 cup of charcoal in here, and I've got 1 teaspoon of psyllium in here. So if you want a larger poultice, you put a 1/2 cup of charcoal and 2 teaspoons of psyllium in there. And then I said to myself, I've got here, add a 1/2 cup of water, which I think I only put a 1/4 cup in there, but never mind, I've got some more over there. So what I do then, that's already, and I made that up, and it's just dry. It's only powder in there. So what I do is I add my water. I shut it up again tightly, and I'm careful because you don't know how easy it is to get it and not shut it up tighter, and then start shaking it and realise that it's still open. And you let that sit, and you come back, and what I do is I get the scissors and I cut that open, and that is a lovely charcoal poultice made there, and it's ready to put on somewhere. I like doing it in the plastic bag because look at my hands. If you've learned charcoal poultices, you know how messy they are. So I've done this so often. Now what I did, and I did this so many times with Peter, I knew how to do them. As I said, I've got the stronger Glad bags here, the bags which they're bluish, and they've got a double Ziploc thing up the top. I found they're just a tiny bit bigger than this, and I used them often. And I did the 1/2 cup of charcoal, 2 teaspoons of psyllium, and the water in there. Then I'd cut them open, and then I'd put them in. I'd put a little bit of chucks on the side of that, on the side of it that goes onto the skin. I'd put a chucks on it like this, fold it over, and then put it on the skin. We put it down there, and we put that over the top of it. Then I bought these. These are just excellent. That's a Velcro belt, and I would just use these and keep it in place. That is snug, and it just stays in place. These belts are fantastic. I bought this online, and if you want to, you've got a little that came with it. That's a hot water bottle goes in there. ideal. Absolutely. You know what? This is another one. I bought both of these. And you could put these anywhere. You want to keep something in place? This is how you keep it in place. You can put it around your shoulders. You know, this area is quite hard to do. Very hard. Actually, like that. See, you can do it like this. And it's staying in place. So, we use this so often. I just knew how to do it and to keep it tight. Obviously, you had to keep it quite tight. Yes? Who's got the microphone?
I was a bit concerned when we were planning to take a bunch of people up with kids bushwalking about possible snake bite, and I just wondered, that little zip bag thing, would that be a good thing
absolutely.
for everyone to have in their own little pack?
Absolutely.
So what was the quantity again? A quarter
it's
cup
in my
charcoal?
book. It's in my book, but
Okay.
what it is about a quarter of a cup of charcoal, 1 teaspoon of psyllium. You don't need that much psyllium. And as it sits there, as you add your water to it, you just let it sit there, but you need something to cut the bag open with.
Yep.
And then you just pop it. And then I have I actually designed some bags. I actually got the sewing machine. I got them a little bit bigger than this, but I designed bags and I sewed them up. So what I could do then is I just dropped the poultices in these bag, and I didn't have to fold them over, and I just dropped them in there. And they were ideal. Now, this is exceptionally ideal if you have any kidney problems. You want to put it on your kidney, you put it on the kidney area around here. You have one for each kidney, and you would use this, like this, to keep it in place. We sometimes used to put it upside down. Sometimes it would be there because where we were putting it, it just worked out better. So you could put it on that area for your kidneys. Oh, it is. I've got it upside down there. That's it. Dr. John Clark from American doctor, he talks about the kidney protocol to get your kidney function back normal. He's got people who have very, very limited kidney function and how they get it back. Part of it is this. Part of it is diet. It is also things, hydrotherapy, using hot and cold hot water bottles. I bought loads of hot water bottles. I got them everywhere in my house because I was using so many of them with Peter. So we had, off and on, they were like, you'd have a hot one and then a cold one. So you get lots of benefits from using hot and cold. So we were using that with the kidney problem. So I actually got the protocol there and I saved it for people. Dr. John Clark? Yes?
Can I just make it clear with the charcoal poultice, is that exposed onto your tummy without plastic around it? I mean,
no, it's usually, you could put it, there's no rule that you can't put it straight on your skin. There's no rule that the black can't go on your skin.
Yeah.
I usually put it in the chucks, right? I wrap it in there because it can, and I've had it where it's not quite the right consistency and you find, oh, look, it's a bit leaked out here or something like that. Look, you'll always get that. You won't always get it perfect because you're a little bit careless with your measurement and you say, oh, that'll do. Oh, it looks like I put a bit much water in there, and you think, whatever. But generally it is. Now, what you've got to be careful of, if you put charcoal in an open wound, now once is not going to do much to you, but if you do it too much, you can tattoo somebody. You've got to realise that. So you've got to be aware of tattooing people if you're putting it on the outside.
So you take it out of the plastic and put it in the
I don't take it out.
sleeve.
I don't take it completely out of the plastic. What I do is I just cut the top side of it out. See, I haven't got quite enough water in there. That's come out quite, I can feel it there. But I would cut that top side out, and then I'd make that, and I'd put that into a little parcel, and I would put that on. That would be put, there's one sheet of, or one thickness of chucks between the black poultice and my skin. As I said, there's no rule that says you can't put it straight on your skin, but generally I usually put it with this, as I said, because of the reason there's always something that falls out. Always. So you can take this this is externally. We finished on externally. I can't think of anything else more. Like you said, we can use this for snake bite. We can use it for spider bites. We can use it for anything. We can use it for bee stings. Now, if you wanted to, you could actually put the charcoal in water and have it as a foot bath, or has it as let's say, I remember reading about one lady, she was bitten by a dog, and she was going, and she actually, her hands swelled up, and she had the red line going up the arm, and she said she just used the hot and cold. But when she did the hot and cold, she actually put charcoal in the water, so that when she was going backwards and forwards, it was charcoal water. So that's going to be excellent too. We're going to combine it with the hot and colds, which we're talking about tomorrow. So we have to realise that there is a chance that you can actually have, like you can do charcoal in the water too, which will pull out a lot of the toxins through the... But you must not take... that's on the outside. I'm just jumping to the internally. But you can take it. So you put it on anything on the outside. Now, internally, as I said, you can take it with water, you can drink it, but don't take it alongside with any medication. How often to change the charcoal? Look, depending what you're dealing with, if it was an acutely infectious thing, I would change it more often. If it's less infectious, I would maybe do it once every 4 hours. It would just depend on what you're dealing with, because it's pulling toxins into itself. So back to internally, you need to be careful not to take it with medication. So if you're on medication, your medication needs to be taken at a certain time, 2 hours either side of the charcoal. You could take either side of the medication, you can take charcoal, but not with your medication. So you can use charcoal in a way while you're taking medication, but not at the same time. Do you understand that? Not directly taking it orally with it. So it actually lowers your blood glucose level. It's good for digestion. It's really good to have just a good clean out. It's good to take charcoal even once a week. Just have a teaspoon of charcoal once a week. It gives you a good clean out. One thing it does, you must remember, you go to the toilet, everything is black. I can remember telling somebody about that this is what would happen. And I told them to take charcoal, and they ended up at the doctors. They thought that that everything was black, that they thought that something crazy was happening to their body. And they didn't realise that this is just a byproduct of it. Just hold on, next one. Where is our man? Thank you.
I just wanted to ask, can you use charcoal for detoxing?
Absolutely. That's the best thing you do. But there's one thing you have to do. When you're taking charcoal, you must be drinking quite a bit of water with it, because it can constipate. So when you're teaching people and you're getting them to drink charcoal, make sure that they're having a good 2 glasses of water with it, because it can constipate.
I'd just like to share, we had a friend visiting who had terrible stomach pains, and I gave him some charcoal. He went out and came back a bit later on, and he was worse. we took him to the doctor. He had a burst stomach ulcer, and the surgeon was a bit miffed that he'd taken charcoal because it kind of showed where all the stomach contents had then gone out into the body.
Okay. Yes. I don't think it'll worry too much, you know. Your body will absorb it.
So, Kaye, if you're going to use it as a detox, what would you do daily?
Yeah, look, I'd take it daily. Okay,
A teaspoon.
A teaspoon every day. It's not going to hurt.
For how long?
How long you want to do it? I don't know. I wouldn't do it long term. It's not something I'm doing. If I'm going to do it long term, I will drop back to maybe once a week. But I don't. I take charcoal periodically, but not all the time. Yes, it's on.
Also, I have to let you know, guys, we use charcoal in the hospital for overdose. When we got a patient who comes to hospital with overdose of any type of medication, including children, sometimes by mistake the children walking around and they take Panadol and they come with overdose of any type of medication anyway, and we use charcoal all the time. Charcoal. We got dissolved charcoal at work, and if they are little kids, we put nasogastric tube, and we put charcoal through the nose, through the nasogastric tube.
Through the nose.
And works very good.
There you go.
So we use in the hospital as well.
Well, Amina, you'd know because she's a intensive care nurse. Yeah. Overdose. Okay, and I can remember a guy lived next door to us, and he had an overdose, and he came to me. He says, "Guess what? I ended up in hospital." He says, "No, they pumped me full of charcoal." Okay, I just charcoal everywhere. He said, because he admitted he'd done a silly thing, and yeah, but he was a very friendly man, and so he was telling us about this, and I knew, and he told me, and I knew that. He says, "No." All the what sort of charcoal do they use? Have they got special grade charcoal or just powder?
Contains charcoal, dissolved charcoal.
Just
100% charcoal.
Just charcoal, yeah. It'd be the same charcoal, yeah. Activated charcoal. Any other thing anybody can remember?
I was just going to ask about, it says in here, reducing the glucose in your blood.
Yes.
What's the protocol?
It's the same. It would be the same. Just taking what you see. There's no rule with charcoal. Mm-hmm. You can take as much as you want. It's not going to do you any harm. Let's say that you were bitten by a very, very deadly snake. You would take charcoal immediately orally. You'd put charcoal on where the bite was, but you would take charcoal orally. And then probably another 2 or 3 minutes later, you'd take another dose of charcoal orally. And then maybe in 5 minutes, you'd take another charcoal. You'd pump yourself full of charcoal as much as you could handle, because you know that is going to neutralise that poison so quickly. But yet I can remember a story, Dr. Agatha Thrash. She said that her granddaughter got bitten by a whole lot of yellow sting bees, and they put her in a bath with charcoal water, but they gave it to that little girl orally too. She was just beside herself, because you imagine how you get stung with a whole lot of bees. Mm-hmm. Yeah, so it's how bad it is and how much you can get down. There's no rule. You won't die from getting an overdose of charcoal. You'll probably get constipated, okay, but that would be the least of your worries if you're about to be poisoned and you're going to die, You don't worry about that. How much charcoal do they put in little ones or for people when they're doing over? 500 mils for but that's watered charcoal. Okay, dissolved charcoal. Okay, so it's very thick that you put in. Okay. There's one question back there first. I think, was it you, Lorraine, or was it Robin? You didn't have a question? Someone had their hand up back there. Or maybe Cheryl.
When Russ and I first went to the Solomon Islands, the first year out there, if we got a scratch, it would turn into an ulcer. And we found that just putting the charcoal compresses on just relieved the pain so much and helped with the healing. It was a real amazing blessing. And when we were out in the village and we'd run out of our charcoal because we'd given it to all the other team that were with us, they just smashed up coal out of the fire, and it worked too. It was such a blessing.
Yeah, it does. Do you know something that's really such a wonderful blessing? Can you imagine such a universal antidote for so many things? And God has made it so readily available. It doesn't matter if you've got no money. You could find burnt wood somewhere. And you don't have to have activated charcoal, because activated charcoal it's not expensive, but it's not like cheap. But it's worthwhile. You need to have some in your house, because you never know when you're going to need it. And it could be you're needing it on some loved one when they've overdosed or something, and you think, oh, I've got no charcoal, what do I do? You need to have it in your house. And if it's sealed, it doesn't have a use-by date. It could be 100 years old and it still could be used. Don't think it's a use-by. It might say 10 years. It doesn't matter if it's more than 10 years. It's not going to harm you if you use it. So have it, but it's got to be sealed. And even if you have, say, underneath your house, I heard somebody had a dead animal underneath their house and they couldn't get it out. They had no way to get it out. So they just threw some charcoal, a container with charcoal in there, and they got some charcoal in there they were able to get it in somehow. And you put a charcoal in a bowl and with water, activate it, and you just put it in there, and guess what? It absorbs the odours into the charcoal. And if you have an old esky that has gone, you've had something smelly in there, that's how you get the smell out of your eskies. You could even do it in men's, teenagers' smelly gym boots and sneakers, charcoal water. Okay, so I'm going to now move on to clay. What is the difference between charcoal and clay? Well, they're both good. And I usually have a little bit of charcoal clay made up in a bowl, and I've left it at home. So I made some up here. I've got a little container of charcoal here. It's just powder. I've just got an empty container that I've put, and usually I've saved my plastic jars with lids on, because when I'm travelling around, I don't want glass because it just makes my whole container so heavy. So I just get the plastic. So I've got plastic and I've got bentonite clay in here. So I've mixed up bentonite clay, and there's two ways you can mix it up. You can mix it up. I've actually mixed up this bentonite clay in water, 10 parts of water to 1 part of clay. And this is in your book, okay? I mix it up very briefly in a blender. Then I quickly pour it into a glass jar, and that will sit in my cupboard. It doesn't have to be in the fridge, but I've sit it in my cupboard, and that is my base drink for detoxing. So I will pour about maybe so much in the bottom of a glass or a cup or something like that, fill it up with water, and that is my detox drink. You can have that every day, and I like that one because it's easy. Charcoal tends to float in the water. You've got to shake it up and you've got to put it in a glass jar and do that, which I do often, but sometimes I do clay. Now this is another detox drink. And it tends to thicken as it sits there. When I came back to this, I had this for quite a few months in there, and I came back and it just sort of was really thick. I couldn't shake it, so I just added more water to it, and guess what? Look at it. You can hear it shaking around. So what I've done there, now that's what you can drink. Charcoal inside. Now I forgot to get, where's my book? There is a difference between doing charcoal and doing clay. One absorbs mycotoxins. Oh, I should get it. I don't know if I've put it in this book. bentonite clay and charcoal. I know, I've got it here and I haven't got it written here. It's in my other book. I've got 2 books like this. One absorbs aflatoxins and the other which is fungal toxins, and the other one absorbs microtoxins. There's a difference, and I can't remember which is which. But look, it's not going to hurt you. Put it on anything.
From last year, I wrote down clay binds aquatoxins, mycotoxins, charcoal binds endotoxins.
Okay, that's it. Charcoal binds endotoxins, and the other one is aflatoxin. You're exactly right. Okay, so here we have, this is clay. Now, what do I use clay for? It is actually much easier, and it just goes on your skin like this. And it stays in place. You can't do that with charcoal. It just crumbles and falls everywhere. So you can make a mixture of clay and charcoal. That works fine. Don't be frightened of that. So use that. That is ideal. Now that is super. I can remember I was over in Fiji and I got bitten by a bee. A bee came and stung me. And I immediately quickly put that on. Immediately it takes the pain out of it. And then when I was talking to one of the ladies who was there as a guest at this clinic in well, it's really a school. They were training medical missionaries at the school, and I was doing a block of teaching. And so they were doing it, and it was a 3-month block of teaching, 3-month block of practical for these students. And so there was guests in the dormitories. There was people there. They were paid money. They came in and they were being treated. And there was this little lady that I knew, and I'd met her in New Zealand. And she was quite round. She had quite a few rolls of fat on her. And she lifted up in between she lifted it up and she saw there was an ulcer in there. And she told me, she said, that is so sore, this ulcer between her. And so what I did is I went to my kit and I just painted some of this clay on her, and she says, oh, that's relieved the pain. Just like that. It does. Another lady, she said that she went outside. One of the ladies who comes to the classes, some of you would know it. You know Beryl. She comes in and she went outside and she ran Rio up her, just underneath her toenail. She was walking out in the garden and she came in and she said she was like in agony, but she had some clay there. So she put the clay on, and immediately it just took the pain out. Immediately. So we need to have this ready. I have this ready made up. I've got a pot of this at home, which I didn't bring today, but I've got a pot of that made ready up. It will get stiffer as it sits longer and longer, and if you need more water, just add a bit more water to it. But don't get tempted just to dip your finger in there and put it on there. Because all those toxins that are on your finger will get attracted in there, and you'll come back to your pot of clay in a month's time and it'll be all mouldy. You have to use a spatula and apply it there. Now, if it was on my skin, once it's on my skin, I can easily, flatten it out with my finger, but not to dig my finger in there. That's one thing you mustn't do, because it will contaminate your whole clay mixture. Yeah, and it does not like metal at all, whatsoever. So I'm using glass here, and I'm using a plastic spatula. You don't use metal because there's a chemical reaction. Now in here, I've got a little metal lid, but it is got that plastic lining and that coating on there, which is fine, and it's all right. But I always choose glass if I can for my poultice drink. That's like a poultice drink. But you know what? You can use this. If you look in the book, there are so many uses for this. But one thing you can use it is people have tattoos. You can fade tattoos with this. It will pull the ink out of tattoos. And so how many people, but if you've got a big tattoo, it's going to take a lot of clay. Okay, so generally what happens, if you put your clay on like that, you allow it to dry. Once it's dry, it's done all its drawing properties, and you just brush it off and you put some more on if you want to. Or if you want to make it last a little bit longer, you maybe put a thin layer of Glad wrap over it to keep it wet longer. So that's another way you can keep it wet a little bit longer. Pardon? Yeah, you could. I've actually, if you're in a situation and you've got quite a ulcerated sore, you can pack it with this. You remember how Sam was saying last night how that person with that lady with the ulcer on the leg, or was it the sore, that gangrenous leg, how they packed it with clay? You can put clay straight in on the wound. But there's another way you can do it, is you can actually just sprinkle it in dry. That would work too. Yes? Will it help warts? I think you asked me about warts again. Okay, I'd say no. I would say the warts are really, you've got to go for, I would go for garlic for warts, burning them off. Yeah, I don't know what else. If anybody else had any experience with warts, banana peels, yes. Yeah, the inside of banana peels too, yes. Radiation plant, you're right, radium plant, radium weed, that's another way to burn it off, yeah. But you can use this as a face mask. You can use this as a hair tonic, like a rinse. It conditions the hair. I've tried it. I've tried lots of these things. I used to say, I think to myself, if I'm going to recommend these to people, I've got to try them and let them know that either it works or it doesn't work. And I say, well, I didn't have too much success with that. They say it works, but, I don't know. Until it dries. See, if you have it very thin, it will dry quickly. But if you have a thicker mixture, this is a much thicker mixture, as you can see, but this one here is a very runny mixture. So how are you going to put it on your face? You can put it on either way, but this will run off quicker, much quicker. This will stick on much longer, but how long are you going to... And you can actually feel it tightening. It really tightens up. And when you wash it off, you can see this red rim where it's been because it's brought blood to the area. And this would be great for acne, for any problem with acne. That's right, Jessie. Painting it on your face with acne. And you make a little pot of this. I would make a little pot of this, get an old glass jar and make some of it, and then you just put it on and you sleep with it on, or you sit there, we'll let it just dry if you're just sitting there doing nothing. Let's say you're sitting there practicing your piano, Jessie. If you're sitting there practicing your piano, you could have a face mask on. That's right, isn't it? Yes. Would it take the wrinkles out? Well, possibly. Do you know what? I also have mixed this with not just water, but with castor oil. Now, that's another brew too. It really does some good drawing power. So don't be frightened. You can mix things. Put extra bits and pieces in it. I talked to you yesterday about carrot poultices. I talked about castor oil, parsnip poultices. There's a couple of things I want to just talk to you about. One more I wanted to talk to you about is comfrey. Comfrey is ideal. Now, you can use comfrey root or comfrey leaf. Now, I've got a few leaves of comfrey at home, but they're pretty sad. They're nearly dead because it dies off in the winter. I've got comfrey leaf. What I would do, comfrey leaf is like a poultice that you would use if you were using it on, it heals bones. Anytime you've got a break in the bone, or anytime you've got a ligament or muscle bruising, or you've got a bed sore, or this actually will start replenishing and will rebuild. It's really great. You can use this for hip injuries, for a broken wrist, for a broken toe. So here are the leaves. This is just dried leaves. And this one is just dried powder. So that is the root. and it's dried, and I've got it as powder. Now it's very mucilaginous. When you're mixing it with water, it comes out sort of like slime, and that's fine. But you can put that one straight on. Now that is excellent if you're treating somebody with a herniated disc in the back. Excellent for it. I know a lady that was she had a herniated disc, and she was being treated for that, and along with some poultices, about 14 days of poultices, she had an extremely herniated disc healed. And the surgeon said he's never seen this before, ever. Because he wanted to operate it on her. She didn't want an operation on her back. So she did these poultices, and she did this water therapy on the back, hot and cold compresses. So you can do it. Now the other thing is, you could do this one ideal. You see, if you don't have the leaves, you use the roots. Both are good to use. Possibly the roots are a little bit stronger, but the leaves are just as great too. You could use this to this is my poultice of choice for lung cancer. Is comfrey poultice. Mullein that's a different herb. I haven't come to that one yet. Okay. Yeah, you buy it. I've got some growing in my yard because I've purposely put it there. But it's a very soft one. It grows about this high, and it grows up to a stalk. The centre stalk has got all flowers on it. And if you pick those flowers and you dry it and you soak it in oil, that helps deafness. Very good for your hearing. Okay, and so what they used to do years and years ago in ancient times, they used to get that centre stalk and they would dip it in oil, and that's what they'd light it. That was their torches that they'd walk along to go places with, and that would brighten the way up. But they called mullein poor man's toilet paper because it's very soft and these large leaves, beautiful large soft leaves. Yeah. But go on. I want to finish telling you about the comfrey poultice. I want to tell you about a story that a lady I know, I don't know if anybody here would know them. Marilyn knows. And do you remember Katie Fennick, Janice? That'd be the only person here who would know Katie. Marilyn would know Katie. Well, Katie was in her 50s at the time. And she decided, she was doing some work down at the place called Highwood, which is a retreat down near Melbourne, in that area down there. And she lived up on the top houses, and she was going down to this health centre, and she thought, you know what, I'd save a lot of time if I rode a motorbike down there. So she got a couple of young fellas to teach her how to ride the motorbike. And they put her on and they got her on the motorbike, but they forgot to tell her how to stop. So what she did to stop, she fell off the motorbike, and the motorbike fell on her leg. Gouged out a whole part out of the back of her calf muscle. Ambulance, she smashed her kneecap. She shattered her kneecap. Ambulance, everything came there, and it was just, went to hospital. 2 weeks in hospital, they were going to fashion a new kneecap. The doctor was going to cut part of her hip bone out, place it on her knees and sew it in place, and that was going to be her kneecap. Have you heard of this, Amina? Yeah. Okay. Anyhow, she was in, and they decided, okay, well, this is all you got to do. What else can you do? And so she was in she was being ready to be operated on. She was wheeled into the operation, and the surgeon looked at her knee. He says, I'm not operating on this, it's too swollen. So back she went to her room. They were going to reschedule the operation. And her husband went in and he says, that's it, I'm out of here. Come on, we're signing out. So what he took her back to Barbara O'Neill's place. Barbara and her staff treated Katie. I knew Katie really well. She was her and her husband were good friends of mine. She's since passed away. But she was there on the couch, and Barbara and her staff were putting comfrey poultices on her knee. I saw her 5 weeks later after that accident, and she was walking around like this on a frame. And she said that the part that hurt most was where the calf muscle was just gouged out at the back of her leg. It was just like a hole there. She said that was the worst part. But she said, and I said to her, tell me what happened. Because Paul got a before and after photo. The first before x-ray was the kneecap is all shattered. The after, all the kneecap came back and drew back in and formed one kneecap. It drew its parts together. All the bones came together. And I said to Katie, now tell me, what did it feel like? She puzzled and she sat. She said, well, I think it's like when you have a baby and the baby moves inside of you and you've got no control over it. And those of you who are mothers know that, it's just all of a sudden you're sitting there and the baby moves. And she said she could actually feel the bones literally moving inside of her kneecap. And Paul and Katie, they were just so excited. And I've heard Barbara tell that story when she's on some of her talks. And it's so true. I know it. I saw it. I saw them there. I saw what she was. And Paul was so excited because there was some big football star that had a similar injury, and he wrote to them and said, look, you don't need to you don't need to have an operation because his career would be finished. And Paul thought he was going to do a right, but he took no notice of him, They have the operation, But Katie didn't want the operation. And look, within weeks, she said after a while, she was still limping for a while, but it wasn't that long when she was back at work. It was only a couple of months. But she said the sorest part was the calf muscle. It wasn't the actual kneecap, because the kneecap came back quite quick.
Sorry, Kaye, was that with the leaves of the comfrey?
Actually, it wasn't the leaves because it was winter time. Okay, they didn't have any leaves, so they just dug up the roots. So what they did is they washed the roots off, and they just put the roots in a food processor and mushed it all up into slurry, and then they put that on. And they put that on and did it constantly, because Barbara had a lot of staff there working there, but Katie was like in Barbara and Michael's house. She was on their couch permanently. Okay, and that's how she sat there for probably 5 weeks. But then she started to get around slowly on a walking frame. And I saw her walking, and I thought to myself, 5 weeks, and she was walking, just very slowly. But not only that, she had the kneecap regrew back together. This is comfrey. This is the power of comfrey. Remember I said to you, it's a bone healing, a bone knitting thing. Another one, I remember when Simon, he had an operation on his leg, the same thing. He's like, does so many remedies, and he works on them, and a number of my family, they do. They know that these remedies do work, and especially when you have a bone break, they're putting it on and they're trying to work it all out and, to get it healed quicker.
What if you have a torn muscle?
Torn muscles would help too, I would assume, especially where it is, it actually helps push it back, grows back together. So I don't know, I'm not saying every single place, but it would be well worth it because you use it on anything torn, any muscles, any ligaments, anything like that. And it actually regrows tissue because it's actually one of the ingredients in the regrowing tissue formula.
I recently did myself an injury.
Hold on, we just get the microphone. We've got to get these guys a bit sharper here. Here.
I recently did myself an injury where I was getting down off the roof and fell through the pergola and hung on by I did hang on, but I had a tearing sensation in my chest. And because I could still breathe, I didn't go to the doctors or anything, and I gave it a few days to to recover. But there was this sensation that I'd had before when I'd broken something. So I just stayed calm and used commercial comfrey ointment, and I just rubbed it over my chest every night for about a month, and all good.
Right.
All healed up.
I've got here, yes, go on.
With the comfrey cream, if you've had plates or screws or
Yes.
things put in, you've got to be a bit careful because
That's true.
pull them out.
That's right. You've got to be careful if you've got screws in. Now, what I've got here is I've got comfrey oil. How do I make comfrey oil? I actually soak the dry comfrey leaves in pure top-grade olive oil. I buy very expensive olive oil. This is like super. Don't get the cheap supermarket grade. Do you think, oh, this is good enough for an oil? Get the best quality oil you can find. Soak your leaves in that. Now this one, I think it's triple strength. What I've done is I've soaked my leaves in the olive oil, keeping the leaves under. Otherwise they can actually, if they're a bit dry, they can go mouldy. And you've got to be careful with your ointments and all, because you've just got to watch them, because you can, all of a sudden you think, oh no, it's gone mouldy, because you haven't done it right. You need to make sure you haven't got too many leaves in there. Okay, so then I tip that out and I strain it. Then I put a fresh lot of comfrey leaves in there using the same oil. And I do it like 3 times. So I've got triple strength comfrey oil. And that gets lovely. That was originally oil, olive oil. And it's got all that green. You can see that green, beautiful goldeny green colour of the comfrey that's in that oil. Now that is super powerful. I would let it sit each time for probably about 6 weeks. Now, this one is the same. What I've done is I've used this oil and I've added beeswax to it and I've made it into ointment. So this is my comfrey ointment as I'm using there. And like you said, we just talked about using comfrey ointment. You did, Sandy, wasn't it? Yeah. Yes, I know. She used to come to our classes. Your auntie, wasn't it? Yeah. Yeah, yeah, that's right. She would make it fair. This one's called bone, flesh and cartilage. This is just using different herbs. You can get use. I've done so many different oils. You've got different oils. You've got some for Bill. This one as especially Bill's bone, flesh and cartilage. And you just got different herbs in the oil that you soak. I don't think so. Okay, I'm sorry. I can't think of everything to put in my book. Okay. Okay. But, a lot of times, would you buy all those herbs just to soak a little bit up, I have done it for years because I just love it and I've been doing it. And people come to me. And another thing which I must talk to you about, and actually I would probably talk to you about, is corn silk. That's the ideal one too. Actually, I'll say it now because I might forget one other time. We've got one on herbs. Corn silk is excellent for any urinary tract infection. So get your corns, pull the silks off, dry the silks out and save them all and keep them. They are excellent. They will just cure urinary tract infections just like that. I can't remember. I'd have to look it up. I've forgotten. I haven't got written on what the herbs are in there. But I've got it in a book. I've got all my books at home that I've got bone, flesh and cartilage. But there's all sorts of different ointments and oils that you can get for everything and anything. As I said, I learned how to do some for hearing. As I said, the oil for your hearing was your mullein oil. You can use any of them. Those for rebuilding flesh. Okay, one last one I'll do. Actually, there's ginger. Ginger is another heating poultice. Yes? Yeah?
Just one quick question. What can you use the oil directly on your skin, or do you just use it for making ointments?
No, I use it directly on my skin. Sometimes I can't be bothered to making ointment.
Yeah.
Okay, and I just use this, and it's a massage oil. You know, you just massage it in. Now, one time I can remember I decided, oh, look, I'd start rubbing it over my body, because I learned that every time you can rub oil over your body, and it made you feel, it helps it. You know, especially you rub olive oil in it. It's in my book about olive oil. You rub it on just, in total, about a tablespoon on all your joints. And I did this for quite a while. And then I decided to rub a little bit of comfrey oil in. But all of a sudden I started to get itchy on my body, and I couldn't work out, why am I itchy? Anyhow, would you believe I went to a class like this, and there was one fellow there, and he says, oh, I've been doing that. I've been rubbing comfrey oil over my body, but it's got too itchy for me. I quit. And I thought, oh, you know, I didn't realise it was going to make me itchy. And he just gave me the idea. Anyhow, one day Simon was saying to me, he said he's been rubbing olive oil over him with comfrey oil. He says, but he's starting to get itchy. And I told him what it was. And all of a sudden you realise that there's certain things you can't do, you know. You have to just be aware of it. But you can do ginger poultice. That's another heating poultice. You'll see that in the book. There's also another one of mustard poultice. That's another heating poultice. You need to be careful in this, because I saw one lady, she actually literally had burns, literal blisters, where she burnt herself from a mustard poultice. In there it says, please be careful, and believe me, you need to be careful. But if you try it out on, you need to try all these things. And I've tried lots of things, and I don't necessarily think, anything, like I've got any problem, but I wanted to know how hot a Kaye poultice felt. You need to know, how hot does it get? How hot does it feel? So how much do you put on? So you have to try it for yourself. Ginger poultices, that's another one. That's good, very good for arthritis. But just one last one before we finish. I'll tell you about oil pulling. Oil pulling is where you put oil in your mouth first thing in the morning, and you close your mouth up, and you just swish it around in your mouth. You do not swallow it, but you swish it in your mouth for probably 10 minutes. And sometimes it cannot be easy, because I used to do it, and I used to be doing my Bible study with it, and I'd be careful, because all of a sudden a little pits, it gets out of your mouth. So what I ended up doing, I ended up putting a mask on when I was doing it, because I didn't want it all over my books, because you'd have a little bit of oil there and a little bit of oil there, and I tell you what, you couldn't believe it. But this is what happens when you go through. And what it does, it pulls, you don't know how many toxins our body gets rid of through our mouth. You know, sometimes I think to myself, you know, the Bible talks about, you know, your mouth, you've got to be careful what comes out of your mouth. Well, I tell you what, there's a lot of rubbish can come out of your mouth in your tongue, but there's a lot of toxins can come out of your mouth through oil pulling. It's incredible. So you just swish it around, and then you do not swallow that oil, and don't put it down the drain, because you can block your drains up. I actually put it in the garbage bin. I just spit it out into a crumpled up paper towel, and I put it in the garbage bin. And I get rid of it that way. 10 minutes is enough, I think. If you can handle 20 minutes, great. But you're a bit adventurous, Ali. Sorry, yes? You find it very effective. Oh yeah, it does work. And if you've got people who've got dentures, get them just to take their dentures out and do it with no dentures in. So that's easy. And so what it does, it pulls out the toxins, it rebuilds your gums, it really helps lots of things. I had one lady, she did it, and she had this problem with her. She had it was like a gum disease, and she was her teeth were so sensitive, and she just didn't know what to do, because the dentist said she had to put this special dental gentle gel over it, and she hated using it. So she actually did oil pulling, and she found she didn't have to use it. The moment she put the oil pulling on, and she could leave it for possibly about, I don't know, it was 10 days, and then she had to do it again. She had to keep doing it again. And she was sold on it. She wrote me a letter and she told me all about how she was trying it because she'd heard me say about it at one of my meetings, and she said, look, it does work. And she was so happy about that. So, and yet I did find another one there was a lady who said, you can do this oil, and I used to do this oil pulling with coconut oil. But she says you can actually do it with castor oil and you don't need to do it as long. You only need to do it for 2 minutes. And I think to myself, well, that's even better, isn't it? So you can do it for 2 minutes with castor oil. Yes, I think it would. It does clear your sinuses. I know one lady, she says, look, it's really made her gums feel very healthy again, and her teeth were so strong and yeah, so receding gums, all those things. So we really need to get into those things. Okay, any other questions before I bring it to a close? Yes? Just hold on.
Where to remove, or someone that removes mercury fillings?
I don't know. You'd have to find a dentist that does it. Just ask around. I can't tell you any that I know at this stage. Okay, so you'd have to ask around. I don't know. Any other questions? Charcoal, does whiten your teeth. But can I tell you, I've used charcoal to clean my teeth with, and I've also used clay to clean my teeth, and I much prefer clay. Why? It's the mess. You know, you clean your teeth with charcoal, you'll get charcoal everywhere. It'll be all up your arm. It'll be all over the basin. It'll be there. One day I decided I'd do a charcoal bath. You've done it too? And did you only ever do one? And you really, why didn't you do it again? I much prefer to do clay baths, I can tell you that. Much prefer to do them. Charcoal, I'd do it if I had an outside tub, but not inside. It's just like a pain, because guess who's the one who cleans it? Yeah, it's messy. Okay. All right then, look, I'm sorry I've kept you a bit late. We'll have a break now and we'll go on and we'll wait for Sam to come back, and thank you for your attention. But isn't it fun to talk about these things? Yeah. Okay then, thank you for everything.